In this 5-minute video, I'm going to describe to you how braces work and how clear aligners work. Hello everyone, this is Dr. Jaz Gulati again with another guide for patients. This time I'm going to talk about the difference between braces and clear aligners. So example of a clear aligner would be the Invisalign system. So that is just one brand and they are a market leader. So we're going to talk about how these actually work. Braces basically work with wires, such as this one over here, and something called brackets, which get stuck on your teeth. So if you remember the phrase train tracks, if you went to school with someone who had braces, they would have had these square blocks on their teeth, and attached to them would be a wire. And the way that braces actually work is that if your teeth are crooked and not lined up, the wire itself, it actually has memory. So if I spring it in any direction, it'll always want to go back in the shape of the arch. So the wire is attached to the blocks on the teeth, and slowly it'll go from crooked to straight, and then at the same time a force is imparted on the teeth, thereby slowly moving the teeth. And that's how pretty much how braces work. So if you go to the GP and the GP might prescribe you some medicine, we, dentists, orthodontists, we actually prescribe force. So our method of treatment is by prescribing forces on your teeth that then gently move the teeth where they need to be. The problem with braces is that the traditional, silver metal ones are not that aesthetically pleasing. However, we do have some ceramic ones available which can look a bit nicer. Here is an example of a case on the screen now that I've treated with braces. So as you can see, there is a deflection or a bend in the wire, and eventually that causes the teeth to push in and become straight. So how does that actually differ to clear aligners or Invisalign, for example? How does the aligners generate a force? And it is a force that is required. So the similarity between braces and something like Invisalign is that they both work by imparting forces on teeth, and the teeth move as a reaction to these forces. So Invisalign, the way it works is that you've got these clear aligners, okay, and they are a little bit springy, as you can see, and what they do is that they can program the forces within the aligners, so that, for example, one surface might be pushing, and that might push the tooth in a certain direction or twist it in a certain direction. So essentially it's using force as well. So both braces and clear aligners both use forces as their mechanism of action. So the way it works is that every week or every 2 weeks, depending on what your dentist prescribes, you change your aligner to a new pack, and then that has a different aligner in it, and every aligner has a subtle change, so that slowly, if you were to bring all your aligners in a row, you'll see that they're slowly becoming aligned and straight. So it's all based on your compliance, i.e. it relies on you wearing these aligners up to 22 hours per day, whereas with braces, they're stuck on your teeth, you can't remove them. So if you think your compliance is not going to be very good, braces are often a better option in these patients because you can't remove them basically. Now, for me, I've had both braces as a teenager, and then later on in life I went on to have Invisalign. I preferred Invisalign personally because it allowed me to remove it and then eat anything I wanted to, whereas with braces, what can happen is that if you eat the wrong things, sometimes the actual bracket itself can ping off, and then you have a dental emergency situation. So they are both great systems. Braces have been around for donkey's years, whereas clear aligners have been around for a few decades, but the technology has really lifted off recently with clear aligners. So if I can show you an example case here, also with the lower front teeth being crooked, and then in as little as 10 weeks, we can get those teeth pushed in. And the other thing I like about clear aligners is that when I use clear aligners, I like to whiten or lighten my patient's teeth at the same time, because they can actually make quite effective whitening trays. So it's more cost effective to the patient, and also there's not 2 phases of treatment. For example, you're not teeth straightening for all that time, followed by teeth whitening. You're both straightening and whitening at the same time. So I hope that explains very quickly the difference between braces and clear aligners. I hope you enjoyed that. Thank you.